You might want to say hello to them again on the
Hello to the virtual audience. I finally unmuted and now you can hear me. Thank you so much for joining us today. I want to thank our sponsors for making today possible. The amazing Randall and Merrill Rice. Thank you very much. You guys stand up. Where are they? There he is. All right. The Tennessee Association of Alcohol, Drug, and Addiction Services have been supporting Tennessee Healthcare Campaign for years and years. Really welcome back and thank you for everything that you do. And they are promoting the Tennessee Red Line for help with addiction services. There's a number to call. Did not mean to do that. Thank you to the Tennessee Hospital Association. Are they here today? I think they're coming, but maybe not here yet. Again, they've supported us for years and appreciate having them with us here today. And a huge thank you to the United Auto Workers, Local 1853, Fort Spring Hill. Sorry, having trouble seeing my. And also the UAW CAP and the UAW Region 8. Really appreciate our labor sponsors. Anybody here from the labor movement? Okay. Yeah, all right, give me a hand. All right. Yeah, I know there were a couple. All right. I'm not going to read all of these, but really appreciate all of these sponsors. The League of Women Voters, the Tennessee Justice Center, the Tennessee Disability Coalition, the Vanderbilt University LGBTQ Policy Lab is the sponsor of today's breakfast. So thank you to them. I want to give you a little background. Tennessee Healthcare Campaign is a nonprofit, nonpartisan social justice, healthcare justice organization in Tennessee. We believe that everyone in Tennessee should have access to equitable, affordable, quality healthcare. And we advocate for programs and policies that improve the health and well-being of Tennessee. My name is Judy Reutman. I'm the executive director. I want to introduce the Tennessee Healthcare Campaign staff. Some of them went through an incredible traffic jam to get here, but I think everybody's here. Our Director of Enrollment Services, Sylvia Casadilla. You guys stand up. Tom Savage, Outreach Coordinator, Susan Veal, the Office Manager, Juana Hodge, the Vaccine Equity Program Manager, Merrill Rice and Priscilla Morales, both insurance agents. You'll get to hear more about the work of our staff at the very last program of today. We're going to be talking about the road ahead and what we're up to. As you can see, we have a very small staff and very large ambitions. And the success of Tennessee Healthcare Campaign really depends on the incredible donation of talent and time on behalf of our volunteers. So if you are a Tennessee Healthcare Campaign board member, volunteer, vaccine ambassador, Appalachian ambassador, on the Zoom, wave your hand. In the room, if you're a Tennessee volunteer, stand up. Everybody stand up. Let's give them all a hand. Thank you for the work you do. This work is hard and sometimes discouraging. And if you're feeling like that today, I hope you'll check out our workshop on the ethics of self-care and listen to our play song that we've got running in the breaks. For me, the words of the songwriter Cy Khan really speak to me. He says, it's people like you who help people like me go on. I'm especially inspired by people who emerge from personal tragedy to dedicate their personal situation to trying to improve the lives of others. And Javonti Malone is one of those people. Javonti was a college student when at the beginning of the COVID pandemic, and his mother passed away early on in the pandemic from complications from COVID. Javonti channeled his grief into action. He's become a vaccine ambassador. He's joined the Tennessee Healthcare Campaign board. And we're so honored to have him involved with us. Another one that's really touched my heart is Frank Zingenheim. Frank's son, Scotty, struggled with mental illness. And when he was thrown off of TennCare during one of those TennCare cut times, his life spiraled out of control and he took his own life. And Frank and his wife, Ann, have offered to share Scotty's story with all of us in the hopes that no other family will have to go through what they went through, and that we can finally get health insurance for the people who really need it in this state. So for Javonti, for Frank, for Louise McCowan, Larry Drain, all the people that that volunteer with us and have really made lemonade and served it to others from the lemons that life has dealt them. I just want to say thank you. I especially want to give a moment's recognition to three people who are not here today: John Stewart, Dr. Dennis S. Freeman, and Sophia K. Barnett. All passed away this past year. And all three of them were really exceptional people. And we were just really fortunate that they chose to donate their time and talent to Tennessee Healthcare Campaign. May their memory be a blessing. I want to give a final recognition to the members of the Tennessee Healthcare Campaign Education and Conference Committee who put together today's conference. You have no idea how hard they worked. And this conference would not be possible without them. So could you guys stand up? Jacqueline Dalton, Ann Lucas, Claire Sullivan, Rich Hannigan. Thank you so much. I want to turn the podium over to Jacqueline now. Jacqueline is in her 4th year, I believe, as Tennessee Healthcare Campaign board member. She served as board secretary. She is the chair of today's convening conference. She works at the National Nonprofit Health Leads as the Director of Community Engagement. And in addition to Tennessee Healthcare Campaign, she serves on the board of the Tennessee Kidney Foundation. She's a Middle Tennessee native with a passion for health equity and public health. She holds a bachelor's degree from Fisk and a master's in public health from Tennessee State University. Please join me in welcoming Jacqueline Dalton.
Thanks so much, Judy. I'm just going to adjust a little bit. The folks in the room can see that I'm a little height challenged, but I just want to make sure that everyone on the Zoom is also able to see me. So let's see, just adjust here. All right. So good morning, everyone. Thank you all for joining us. I have the pleasure of introducing the individual who's going to be introducing our keynote. But first, I want to run through a few items with you all this morning. And so we're going to go to the next few slides. And I don't think we showed all of our sponsoring friends, but just wanted to give a shout out to these folks as well. Thank you. Okay, so I just wanted to talk about sort of an overview of the day. Judy talked about how hard we've worked, and we have some fun things planned for you all. And that includes an excellent lineup of very exciting speakers. And That also includes, first we'll hear from our keynote speaker, Regional Director Antrell Tyson, and we'll also, at some point within the day, wanting to be doing a group photo. So we'll probably do that following, a group photo, you all. You don't look excited, but when's the last time you got to take a group photo? So that's an exciting thing that we also have planned after his presentation. And our first set of workshops will be in, first, the advocacy one will be in this room. So also if you're virtual, you'll be staying in the main room for the advocacy conversation. If you'll be joining the other two rooms, if you are going to maternal health or looking forward to talking about mental health and self-care today. Those breakout rooms are also available to you all on your Zoom platform, and I'm going to run through those logistics here in a moment as well. And we also will be having lunch today. Lunch is catered by Panera, and it's also sponsored by, you saw the LGBTQ Policy Lab, and special thank you to Professor Gilbert Gonzalez from Vanderbilt University for that sponsorship. During lunch, we wanted to have an opportunity for everyone to be able to do more talking, more networking, and also self-care, which we have some longer breaks planned out for you all, and we'll be recommending some mindfulness activities for you throughout the day. So if you're wondering, why do we have a 30-minute break? It's because we want you to take care of yourself while also being an advocate in this work. And we know it's a Saturday, so why not do a little self-care on a Saturday as well? But also during lunch, we'll have an activity going on, which will be THCC bingo. So if you're in person with us, you'll have the ability to grab a worksheet, and as you're networking, try to mark off some of those bingo slots. There is a special prize for our THCC bingo. And if you're virtual, I'll be facilitating with you in the discussion forum / bingo room, and we'll be doing a virtual format of the THCC bingo there as well. Then this afternoon, we'll be having another set of concurrent discussions, and those will include, again, a focus on maternal health, mental health, as well as advocacy. So we have some very special speakers for you, and hope that you will stick around for those, which includes a special conversations focused on Black maternal health, a conversation from Ty Borders and Elliot Pinsky on mental health care access in rural Tennessee, as well as a conversation with Abby Emanuelson talking about building strong coalitions for Medicaid expansion. And then finally, we'll be going back to Judy, talking about the road ahead for the Tennessee Healthcare Campaign. There's certainly lots of work and funding, right, that Judy has been able to help establish a good foundation, not only through COVID, but also going forward. And so we're really interested in hearing her talk about the next steps for the Tennessee Healthcare Campaign. Just quickly, I wanted to, for our folks who are virtual, just talk about the Zoom platform. You've probably heard about this a lot over the last few years, especially if you've joined a webinar or two. But we just wanted to point out, and I'll use the cursor here, that one thing we will be recording during the day. So we'll record the breakout sessions as well. If you are on virtually and you want to see the other folks who are joining us today, which we do have a number of individuals joining us virtually, you are able to click the gallery view and see more of those individuals. We also want to highlight this chat function and hope that you've already begun to introduce yourself to one another using that chat function as well. Throughout the day, we welcome you to submit any questions via chat also. And I also want to point out that the breakout rooms are going to be on your, you have to click on your Zoom, I like to call it a taskbar. So on your Zoom taskbar, you'll click more, you'll have a drop-down box, and on that drop-down box, you should see breakout rooms. I know it's not listed here on this screen, but this is what it will look like. Breakout rooms will be listed towards the top, and you'll be able to click that and choose which room you want to join throughout the day. You also have the ability to jump in one room and then jump out and jump into another room if you have that preference. same thing here with you all as well. You know, feel free to, to jump around to different rooms. We also want to mention that the speaker bios and objectives are listed online today. So if you have a smartphone, you can take that out, open up your camera app and point it at this little QR dino icon, and you'll be navigating to the speaker bios online. So I'm just going to give a moment because I see some folks are doing that. All right. Give just another second. Okay. All right. Well, actually, I'm going to go back just quickly. So you have another moment to take a shot, take a picture of that screenshot. I do want to mention a few things for our folks who are here in the room. Of course, the restrooms are right across the hallway from where we're at today. If you have not ventured down the hallway to my left and around the corner, that's where we'll be having lunch today. And we do have some refreshments there for you all. So feel free to trickle back over if you need to and get some of those refreshments. We also want to mention that we have evaluations going in your packet. So please be sure to fill out that evaluation at the end of the day. You might be filling it out throughout the day. We do have masks, although I'm not wearing one for our folks who are virtual. We do have masks available when you signed in. So, and you pick up your name tag, you should have seen some masks there for you as well as a lot of hand sanitizer. We also have Tennessee Healthcare Campaign t-shirts available for $25 in the front if you would like to have one of these really cool t-shirts. And I think that's everything that I need to mention for now. And so I'm gonna go ahead and introduce one of our special guests today, John Ray Clemens. And John Ray is a Tennessee State Representative for District 55. And I did have your bio here, but it's not listed right now. So I'm going to ask you to come up, as you come up, say a little bit about yourself, please. And even if you want to share a little bit what you shared about with us about what you've been doing this summer, please share that with us. But really appreciate you for being here so much to introduce our keynote speaker. So please give a round of applause for John Ray Clemens.
Well, good morning. I think I'm on camera here. All right. Good morning. Morning. All right. It's early in the morning on a Saturday, and it's great to see all of you here. I know that every one of you could be doing a million other things this morning on a Saturday, but you chose to be here because you care about this issue and your fellow Tennesseans. You know, I'd venture to guess that everybody in here has access to healthcare of some type, but you're here because you know that our brothers and sisters across the state of Tennessee don't have access to quality, affordable health care. And that is a real problem. And that is, that says something about our state of Tennessee and our priorities as a state. As was said, I serve in the Tennessee General Assembly, represented District 55 since 2014. As most of you know, and I've spoken with most of you since redistricting, that whole interesting affair. District 55 looks very different now than it did 6 months ago, so to speak. So 98% of my district is brand new because of one reason. I speak out. I speak out on behalf of our fellow Tennesseans. You know, I represent about 70 to 80,000 Tennesseans, give or take, but I feel like I have a duty to represent all 6.9 million Tennesseans. Every family in the state of Tennessee matters. We have to care about everyone. And unfortunately, right now in the General Assembly with the supermajority that's in control and this governor, that doesn't appear to be the case. But because I speak out and because I fight for our values, I've become known as somewhat of a feisty fighter legislator, I guess, so to speak. They thought they would have some fun with my district. And to their chagrin, I'm running unopposed this year. So During my short tenure, I've had the opportunity to serve on the health committee every year, except for that 7 months where Glenn Cassida was in charge, and he tried to put me on the agriculture committee to punish me, but he didn't realize I'd grown up on a farm. So I actually knew more about agriculture policy than I knew about healthcare policy when I started. And also that's where all the environmental legislation comes through. So I was kind of a thorn in their side on that one as well. But I quickly went back to the healthcare committee, and as most of you know, and with whom most of you have worked, we've worked very hard on mental health care parity and substance abuse equity issues. We fought since day one to expand Medicaid in Tennessee. Unfortunately, we haven't been successful, but we must continue that battle. And we must continue to fight because that matters. Our values are worth fighting for. And our brothers and sisters across the state of Tennessee are worth fighting for. And I can promise you, because I'm unopposed, when I go back into office in January, I will continue to help lead that fight to carry out your mission. The Tennessee Healthcare Campaign does extremely important work, and I can't applaud you more. And as you were going through these sponsors and the people with whom you've partnered on this event and many others, you know, they're all friends because we're all in this fight together. And those are the people who show up when it matters, just like you, the unions and these other organizations. Every time there is a real issue confronting the state legislature that's going to impact a lot of people, you show up, they show up, and we actually battle. We may be few in numbers, but we carry great weight. And that is a great tribute to the work that you do with your small staff and my small caucus. We do great things together, and we can do better things in the future if I continue to work together. So without further ado, I want to introduce the gentleman with whom I've had the opportunity to meet this morning and speak about important issues, who truly is, you know, thank goodness for President Biden. I think we all breathed a tremendous sigh of relief the day that he was elected, and we have been rewarded for that ever since, because I dare say he's probably been one of the most successful presidents and accomplished more in his short term thus far than any other president in my lifetime, and potentially others. And he obviously has great taste in appointees, like the gentleman I'm going to introduce today. So it's my distinct pleasure to introduce Mr. Antrell Tyson, Esquire. He's the Director of U.S. Department of Health and Human Services in Region 4. Mr. Tyson was appointed to serve as Regional Director of the U.S. Department of Health and Human Services for this region in March of 2022. As a presidential appointee, Regional Director Tyson provides executive leadership in Region 4 as the primary representative for the Secretary of Health and Human Services. He's tasked with intergovernmental and external affairs, which brings together federal, state, local, and tribal government organizations and private sector businesses. That's quite a haul to get all those people on the same page. I can only speak for the state, but God bless you. In his role, Regional Director Tyson is responsible for 8 southeastern states, including basically the SEC, including Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, we might take them someday, South Carolina, and of course, the great state of Tennessee, as well as the region's 6 federally recognized tribes. Before joining HHS, Regional Director Tyson served as the Director of Business Services and Policy for the City of Atlanta's Workforce Development Agency. And prior to that, he served with one of our good friends here in Nashville, who visits us often, as the District Director for the U.S. Representative Lucy McBath. And I appreciate her work on gun sense legislation and the tremendous bill that was passed earlier this year. The Atlanta Business Chronicle has recognized Regional Director Tyson's commitment to public services in his top 40 under 40. He holds a Bachelor of Arts in Political Science from Colgate University and a Juris Doctor from the T.C. Williams School of Law at the University of Richmond. He resides in Atlanta, Georgia with his wife, Laurie, and their son, Dorian. Regional Director Tyson is joined today, I believe, virtually by Ms. Natalie Perry, who is the Regional Administrator of HRSA, Region 4, the largest of 10 regional offices, and she leads the development and implementation of innovative strategies to address regional priorities and accomplish the goals of the agency. And ladies and gentlemen, please do not take offense that as a fellow father, I have 3 boys, all of whom play Little League Baseball and flag football all day, every Saturday, and I happen to coach every one of their teams. I will be departing after this introduction, but please do not take offense. I am with you arm in arm in our march forward towards that mountaintop to expand Medicaid in Tennessee and provide our brothers and sisters working with the Biden administration to improve the lives of our fellow Tennesseans. So without further ado, I introduce our new good friend, Director Tyson, to discuss building bridges to healthcare access.
Thank you, Representative Clemens, for that warm and welcoming introduction. And thank you. Oh, okay. You get on. There we go. And I know I got blessed twice with in the height category, so let me readjust this. Are we there? Great. Now, there we go. All right. So thank you again for having me this morning, and thank you, Jacqueline and Judy, for inviting me to be able to keynote such a very important event today. And thank you to the Tennessee Healthcare Campaign and the staff for hosting this annual advocacy conference today. As Rep. Clemens mentioned, my name is Antrell Tyson, and I'm the Regional Director for the Department of Health and Human Services. And in this role, like he had mentioned, I'm responsible for advancing and advocating the priorities on behalf of the Biden and Harris administration. So as he went through the list of states, you know, some people may say that I drew the short straw when it comes to the states, when it comes to the Biden and Harris's priorities, right? Now we have the states, most states that have not expanded Medicaid. You know, we have the states that have the highest maternal mortality, but I don't think of it that way. I think that this is the best challenge and the perfect opportunity for me to do meaningful work in the part of the country that I care dearly about as a resident and a product of Georgia, and for an administration that cares deeply about citizens of all race, creeds, ethnicities, and backgrounds. And it's also an opportunity for me to work closely with my partners in the region to do work to think of creative solutions to be able to address you all's needs. And it also allows me the opportunity to travel around the region and to visit organizations like the Tennessee Healthcare Campaign, to meet, as Secretary Perry mentioned, real people doing real things. And for that reason, it's an honor for me to serve in this role today in this region here. Now, while I was appointed in March, as you can imagine, I had to hit the ground running. However, before I even came on the job the first day, this administration has been focused on improving the health and well-being of all Americans. From tackling the COVID-19 pandemic, to addressing behavioral and mental health care crisis in our country, to expanding access and reducing costs for healthcare, this administration has made real progress on its priorities. We have more tools than ever to prevent and fight and treat COVID, including vaccines, boosters, and therapeutics. And during last year's open enrollment, a record 14 million people enrolled in quality healthcare coverage through the marketplace, including 6 million new enrollees. And during the pandemic, Medicaid and CHIP enrollments grew from 71 million to 83 million people, the largest single increase in the program's history. And we prioritized behavioral and mental health investment by investing billions of dollars in programs, block grants, and other initiatives. But most recently, the president has signed one of the most historic laws to lower healthcare costs for families, create good paying jobs for workers, and to grow the economy from the bottom up and the middle out. Starting from the premise that healthcare is a right and not a privilege, this administration believes that every American deserves a peace of mind that quality, affordable health insurance brings. Americans facing illnesses should never have to worry about how they're going to pay for their treatment. They should not have to decide between buying life-saving medication and putting food on their tables. The Inflation Reduction Act of 2022 will lower healthcare costs for millions of Americans and put money back in the pockets of American families and seniors. Under this bill, hundreds of thousands of Tennesseans will be protected by catastrophic drug costs by capping Medicare beneficiary out-of-pocket costs in Part D at $2,000. Currently, Medicare beneficiaries with conditions such as cancer, multiple sclerosis, lung disease can face thousands of dollars of out-of-pocket prescription drug costs, and millions of Medicare beneficiaries struggle to afford their medication. This bill will require Part D plans to offer better financial protections, which will begin to phase in 2024. Each year, that will benefit roughly 37,000 Tennessean Medicaid beneficiaries who otherwise would have to pay an absorbent amount of out-of-pocket costs over the cap. This bill will also save billions of dollars for seniors and people with disabilities and the federal government by allowing Medicare to negotiate prices for high prescription drugs. And it will also slow down the rapid growth of Medicare prescription drug pricing by requiring companies to pay Medicare a rebate if they increase drug prices faster than inflation. That will achieve billions more in savings for the federal government, and it will further reduce the out-of-pocket costs of Medicare beneficiaries starting as soon as next year. The Inflation Reduction Act will also save Tennessee Medicare beneficiaries money by capping insulin copays at $35 per month. Drug manufacturers have raised insulin prices so rapidly over the last few decades that some Medicare beneficiaries struggle to afford their life-saving drugs at a cost that costs less than $10 a vial to manufacture. This legislation will cap the out-of-pocket costs for insulin for nearly 83,000 Tennesseans, and that will pay no more than $35 for a monthly supply. This bill also provides extra help for paying for drugs and Tennessee Medicare beneficiaries with low income by expanding eligibility for full Part D low-income subsidies, known as extra help to low-income beneficiaries with incomes up to $150, 150% of the poverty limit rate. And it also saves tens of thousands of Tennessee Medicare beneficiaries monies by ending cost sharing for vaccines in Part D. Now, President Biden has also promised to build upon the Affordable Care Act by making premium tax credits more generous and lowering the healthcare premium of working class families. The American Rescue, I'm sorry, I'm so congested. I would wake up with a sinus, something going on the day that I would have to speak. So if you hear me sniffling, it's not COVID. I tested before I got on the plane. But yeah, so the American Rescue Plan keeps that commitment by improving premium tax credits and helping the U.S. reach its lowest uninsured rate in history. But those improvements were set to expire in 2022. But with the Inflation Reduction Act, it continues those critical improvements until 2025, preventing premium spikes this January. Continuing these ACA improvements means saving hundreds of thousands of dollars for Tennesseans of about $720 per year, and allowing tens of thousands of Tennesseans to gain coverage, which will improve the outcomes, health outcomes, and save lives. Now, while this administration has done a lot to improve healthcare for all Americans, we acknowledge there's still a lot more work to be done. We will continue to support your efforts in expanding Medicaid in the state and show how expansion has not only improved the lives of Tennesseans, but it also makes financial sense for the state. According to the Kaiser Family Foundation, more than 25,000 uninsured adults in Tennessee could be eligible for Medicaid if the state decided to pass Medicaid expansion. Also, thanks to the American Rescue Plan, states have even more of an incentive to expand Medicaid. States that have expanded Medicaid can receive 5% points increase in their regular federal match rate from the Medicaid services. This is in addition to the 90% the federal match that they already received through the ACA. And for every year that the state fails to pass Medicaid in this state, they leave $22.5 billion on the table. And hospitals lose $7.7 billion in uncompensated care. But again, because the Biden and Harris administration believes that healthcare access is a right for all and not a privilege for the few, we remain committed to work with the remaining holdout states toward Medicaid expansion. And in addition to expanding Medicaid for eligible Americans, we also have a lot of work to do with the public health emergency unwinding to ensure that no one loses coverage due to procedural reasons outside of their control. To prepare for this unwinding, HHS and CMS are executing a whole of government approach to develop national outreach campaigns so states, advocates, and Medicaid enrollees know what to expect when the PHE ends. Estimates show that several 100,000 Medicaid recipients could potentially lose coverage as a result of the public health emergency unwinding. But I know because you all care enough that you're here on Saturday morning, that you all will not allow that to happen in Tennessee, right? Right? There we go. So we look forward to a continued partnership with the Tennessee Healthcare Campaign to ensuring that we make sure that Medicaid recipients don't fall off the rolls once the PHE happens, and we will continue to fight the battle in the legislature to ensure that this legislature does the right thing and expand Medicaid. So while this administration has done a lot and continues to do a lot to improve the access to healthcare in America, there are a lot of existing resources that are currently available through federal programs. As a political appointee, it is important for me to go around the region to fight to advance the policy priorities of the administration. But it's also equally important that I provide access to the resources that we already have available to you. So with that said, I invited one of my best subject matter experts from the regional office who has prepared a presentation to show you the vast amount of resources HHS has available to you. Oh, there we go. And so without further ado, I would like to introduce Ms. Natalie Perry, the Region 4 Regional Administrator for the Health Resources Service Administration, where she leads the development and implementation of innovative strategies to address the regional priorities and accomplish the goals of the agency. So thank you, THCC, for inviting me this morning and having an opportunity to speak with you. And without further ado, Ms. Perry, are you there?
Yes, I'm here. Good morning, everyone. I seem to be having some internet problems. Can you hear me?
Yes, we do.
Very good. Thank you for the introduction, Artie Tyson. It is my pleasure to be here, and I appreciate the technical support to advance the slides. I'll start on slide 2, please. Advance one more, please. Back one. There you go. We'll get it together. All right, good Saturday morning, everyone, and thank you, Executive Director Reutemann, for inviting HHS and HRSA to be a part of the Tennessee Healthcare Annual Advocacy Conference. Although I could not be there with you at the Nashville School of Law, I am very grateful for the technology that allows me to join virtually. I serve as the Regional Administrator of the Atlanta Regional Office of the Health Resources and Services Administration. I'm a nurse by discipline, and I've been with the agency for nearly 20 years. Our Office of Intergovernmental and External Affairs works to educate and connect people and healthcare organizations and amplify promising practices. And probably because most of you are in healthcare or public health, you already know that our programs at HRSA support equitable healthcare for people in need. We serve people with low incomes, people living with HIV, mothers and families, rural communities, transplant patients, and underserved communities. It's my pleasure to join you, Regional Director Tyson, to share how HRSA builds bridges to healthcare access. I know that there are several licensed social workers in the audience today. Why? Because of the CEUs. I know that you're there because I'm a nurse and I need CEUs as well. And I believe that social workers are among public health professionals that understand and can address need exceptionally well. You understand the true meaning of community engagement. You meet people where they are, and you serve as the glue that really forms multi-sector collaboration that is essential to address health disparities. Regional Director Tyson and I are here this morning, because we know three things. One, you cannot improve health disparities sitting behind a desk. One of the 7 habits of highly effective people is first to seek to understand. The best way to understand a person, an underserved community, or the circumstances of a population is to spend time in their environment and then allow them to form the problem statement in their own language and offer homegrown options for solutions. The second reason we join you this morning is that we want to make sure that the essential resources that are provided by federal agencies actually reach the end user. And here's an example. I grew up in rural Sumter County, South Carolina, in a community of about 200 people. There's a single road that leads to my home community. It dead ends on the Wateree River, and there are no traffic lights there now. There were no traffic lights there when I grew up. It's a pristine rural community that is now being disturbed by a barrage of phone calls to purchase land and displace the long-term residents whose ancestors worked long hours, often without pay, to secure the land that they're living on. Why? For resort amenities. There was only one organized institution in that community when I grew up, and there's still only one organized institution, and that's the house of worship. We are here to learn more about meeting people where they are. You know the end users, like the people in my home community. You know how to reach them and how to make sure that they understand the federal resources that are available to them. It's organizations like the Tennessee Healthcare Campaign that can ensure that end users know where to go and who to call to access high-quality healthcare, regardless of their ability to pay. And finally, the third reason we're here is that we know that multi-sector collaboration also applies to the federal government. We cannot create constructs for state and local and tribal entities that we're not able to demonstrate internally. R.D. Tyson and I work together on a regular basis, and collaboration is the operational framework that he instills in the daily work of the HHS agencies seated in Atlanta. If we ask you to promote multi-sector collaboration, we also make it a priority to demonstrate multi-sector collaboration within the federal government. This is how we build bridges to maximize the 20% contribution of access to quality healthcare, which brings me to my key message, maximizing the 20%. Advance, please. Next slide, please. These are the 5 things that we want to make sure that every Tennessean knows. Now, you know that HRSA has more than 90 programs for underserved populations, but these 5 things are critically important, so let's start here. In the time that I have, I'll focus on these 5 resources because they do enable us to bridge gaps in healthcare to improve health outcomes. 2 are relatively new resources. Others have been around for more than 50 years, and still you will encounter Tennesseans who have never heard of a health center, never heard of the National Health Service Corps. A simple goal for us as public health professionals and healthcare professionals is to ensure that all Tennesseans know how to access these 5 resources: health centers for primary care, the 988 Suicide and Crisis Lifeline, the new Maternal Mental Health Hotline, and the National Health Service Corps. So let's view these resources as actual bridges to healthcare access. Next slide, please. So when the Biden-Harris administration came in, as Artie Tyson just illustrated, racial equity in healthcare were two immediate priorities. In terms of racial equity, President Biden wants to end health disparities in healthcare access and education. In terms of healthcare, he's keenly focused on expanding our access to quality, affordable healthcare, hence the continued fight for Medicaid expansion in Tennessee. Within the top department, the top task and priorities, as you know, in public health, focus on monkeypox, the baby infant formula crisis, COVID-19, overdose prevention, and HIV/AIDS prevention. In healthcare, the priorities are centered around reproductive health care, health insurance, vaccines and immunizations, COVID-19, Medicaid, and Medicare. Next slide, please. At HRSA, our administrator, Carol Johnson, has translated these department priorities into 4 categories, and they are maternal health, behavioral health, health workforce, and COVID-19. Those are our agency's top priorities. Next slide, please. At HRSA, we build bridges to healthcare access to improve health outcomes and achieve health equity through access to quality services, a skilled workforce, and high-value programs. Next slide, please. There's a close relationship and correlation between our HRSA mission and the mission of the Tennessee Healthcare Campaign. There's kinship when it comes to affordable healthcare and equitable access. But how far will access take us in terms of overall health? Next slide, please. If we take a look at where we live, our zip codes, our physical environment, according to the Institute for Clinical System Improvement, when you're building bridges to healthcare access, only 10% of what goes into your health is attributed to our physical environment, but that 10% can have some exponential impact. Next slide, please. Our zip codes affect our overall health more than our genetic code. We all know that. The choices we are able to make at home are sharply influenced by the choices that we have, as illustrated with these 2 counties in Sonoma County, California, where there's a 10-year difference in life expectancy. And this is related to poverty, educational level, income. So our neighborhood environments can either support health choices or have conditions that induce chronic stress, as we know. Things like access to fresh fruits and vegetables, continuous exposure to advertisements about alcohol and tobacco, even feeling safe enough to go outside to be active. All important, but equally important to us are the connections between people and between healthcare and public health organizations. So as public health and healthcare organizations, we need to educate our communities, improve health literacy, connect partners, and amplify approaches that work. So Tennessee, with the 2nd highest number of hospital enclosures, has an environment that severely limits access. And as Shepherd is illustrated on the screen in Sonoma County, California, this could clearly be one of your 7 at-risk counties in Tennessee: Hamblin, Bedford, Hardeman, Hayward, Lauderdale, Crockett, or Madison. Next slide, please. So collectively, when we look at all that we do to provide access to high quality healthcare, it only adds up to 20% of what influences our overall health. Everybody in the room and everybody in the virtual environment, we know that 80% of what goes into our overall health is found in our health behaviors, the physical environment, and socioeconomic conditions. So for patients and families that have complex health issues like chronic disease, substance abuse, mental health issues, managing the care is getting more and more complex as time goes on. COVID was introduced 2 years ago. Now we have monkeypox, polio, very complex. So while every community has a unique mix of healthcare challenges and systems, working with resources beyond the clinical walls is going to be our key to treating patients with these complex issues. And this is where clinical social workers excel to achieve effective healthcare and better health. Advance, please. Next slide. So the question is, how do we maximize that 20% that's attributable to access and the quality of healthcare? Next slide, please. So in this slide, just continue to advance until you get to the box that's in the left side of the screen. Continue until you get to the box in the left side of the screen. Thank you. Keep going. So first, we need to continue to work towards ensuring that every single Tennessean knows where to go and who to contact to access healthcare when they are uninsured, underserved, unemployed, underrepresented, or unfinanced for a healthcare career. Advance, please. Next slide, please. Next slide, please. Secondly, let's advocate for equity versus equality. And I really like this slide because it really brings it home. We all know that equality is not synonymous with equity. Our underserved communities, as you may know, may require a larger distribution of resources to ensure equitable access to healthcare. So the bridge for an underserved community in Crockett County may need a different proportion of resources than a similar underserved community in Hayward County. So to achieve health equity collectively, we must use our impact, collective impact, to eliminate systemic barriers to opportunities and benefits for people of color and other underserved groups. Next slide, please. This is to put a punctuation mark behind a program that has been around for more than 5 decades. Our HRSA-funded health centers have been around for more than 57 years. But again, there are still individuals who may not know that high-quality healthcare is provided regardless of an individual's ability to pay. Next slide, please. Across the nation, we know that 1 in every 9 children, 1 in every 3 people living in poverty, and 1 in every 5 residents receive care at a HRSA-supported health center. In Tennessee, there are 29 health center program grantees providing care for more than 400,000 patients in 2021. Advance, please. The next slide shows that these 29 centers are distributed across East, Middle, and West Tennessee. There's not one in every county, but we do have an access point online where people can find the health center that's most proximal to them. So on the next slide, we included this to illustrate that to build bridges to healthcare access, we want to make sure that every single Tennessean who knows how to find affordable care. Most people have a cell phone on their internet browser. If they type in find a health center, put in their zip code or their city, they can find the nearest health center. Next slide, please. And I'd also like to highlight at the state level, this HRSA supported grantee, this Tennessee Primary Care Association led by CEO Libby Thurman, also there in Nashville. This organization is there to connect people to healthcare and also organizations to health centers to bridge the healthcare gap. The Tennessee Primary Healthcare Association proudly facilitates collaboration between our health centers, the governor, state health departments, for example, and they want to ensure that there's awareness of the health center program and its value to patients, and also to encourage collaboration among health centers to identify the best approaches to meet the needs of Tennessee residents. Next slide, please. Another way to build bridges to healthcare access is to make sure that every single Tennessean knows how to access care during a behavioral health crisis. And at the top of the hour, Ms. Reutemann talked about channeling personal tragedy into strategy. And this is a personal story for me. Had a very close family member that died by suicide right in front of my eyes. Never saw it coming. He never said a word. And often that is the case. It's not overt, it's very covert. Next slide, please. Suicide just happens to be the leading cause of death for people aged 10 to 34. He was a little older than that, but nevertheless, he succumbed to this unnecessarily so. In 2020, across the nation, the United States had 1 death by suicide every 11 minutes. So in July, the United States transitioned from a 10-digit suicide prevention line, as you all know, to 988, which is an easy to access 24/7 crisis care line. 988 is a part of President Biden's comprehensive strategy to address our nation's mental health crisis. This lifeline is a network of more than 200 local and state call centers supported by HHS agency, the Substance Abuse and Mental Health Services Administration. And yes, I'm supporting another agency's resources. Typically, we only advocate our own HRSA funded resources, but again, collective impact. We need to share and promote what makes sense, what is going to help the people in Tennessee achieve the best outcomes. So we ask that you try to ensure that every Tennessean knows that 988 exists. So if they get into a crisis like my family member, they can call and get the needed help in time. Next slide, please. Maternal health. That's one of the topics on your agenda in more than one location. And we know that between 2017 and 2020 in Tennessee, 113 women died from pregnancy-related causes. So that's 113 too many. In the South, the burden of pregnancy-related death is higher among non-Hispanic Black women. So let's work together to ensure that this population and all women of childbearing age, again, know where to go and who to call to access high quality care. Next slide, please. Postpartum care is critically important. And we know that in the postpartum period, this care encompasses a wide range of maternal health needs. It could be recovering from childbirth, health maintenance, follow-up on a pregnancy that was complicated, management of chronic conditions, counseling for birth spacing, access to contraception, or addressing mental health conditions. And the extent of postpartum coverage, it can vary significantly depending on where the woman receives it. But in Tennessee, with 12 months of coverage, mothers now have a very strong bridge for positive outcomes. Next slide, please. This slide just highlights briefly our home visiting program that many people may not be aware of. Across the nation in 2020, the home visiting program provided services for more than 1 million homes. And we know that evidence shows us, research tells us that these home visits improve the lives of children and families because they help to prevent child abuse. They improve maternal and child health, and they promote child development and school readiness. Next slide, please. I'm getting short on time, so just briefly, this slide shows the distribution of these evidence-based home visiting programs across the state of Tennessee. It's not available in every county, but where it is available for now, we do encourage you to take advantage of that service. Next slide, please. May was a good month for maternal health in Tennessee. One, because postpartum care was extended to 12 months. And also on Mother's Day this year, HRSA announced the new maternal mental health hotline. The maternal health hotline, as you probably already know, provides free confidential support before, during, and after pregnancy. Again, let's make sure that every Tennessean knows how to access the maternal health hotline. And the numbers provided there is 1-833-9-HELP for moms. Not quite as abbreviated as 988, but a very valuable resource. And when we listen to the testimonials of women regarding their birth outcomes, we can learn a lot. In Atlanta, we recently joined with several other regions to have a tri-regional maternal health summit. And I recall the testimonial of a woman who was pregnant with twins and in distress. She went to the hospital and she was left in the hallway outside of the emergency room unattended. She went to the hospital pregnant with 10 twins, but she ultimately left with one baby. The hotline would have been a good support for this new mother who should have had 2 babies, but only came home with 1. So issues like postpartum depression or just having issues and not knowing who to call, that's the purpose of the Maternal Mental Health Hotline. And then finally, a word about the National Health Service Corps. In terms of bridging access to healthcare, the health workforce is critically important. And as you all probably know, the National Health Service Corps provides loans and scholarships to support the development of the healthcare workforce. But from a personal perspective, I was 35 years old, had finished nursing school and paid off all of my loans independently when I learned about the National Health Service Corps as an employee of the Health Service and Health Resources and Services Administration. So today, do you think there are any students in Tennessee like me who never heard of the National Health Service Corps? Probably so. This program is about 50 years old. So we request R.D. Tyson and I to make sure that every student who aspires to become a healthcare professional knows about the National Health Service Corps loan repayment program and knows how to take advantage. Advance, please, to the next slide. Just briefly, time is short. The National Health Service Corps and Nurse Corps provided care for more than 21 million people in 2021. And we just want to make sure that everyone knows that this support is available for medical, dental, mental health, and behavioral health professionals. Next slide, please. So here's my take-home message. Let's maximize the 20% contribution of access to health care through multi-sector collaboration, and let's ensure that the end users, the people in communities across the state, know where to go and who to call to bridge the gap in healthcare access. We want to make sure that every Tennessean knows 988. Every Tennessean, every mom or potential mom knows about the Maternal Mental Health Hotline. They know how to find health care, how to find HIV/AIDS care, and to learn more about the National Health Service Corps. Next slide, please. This is the final slide, and this is the most important slide in the entire deck. And this is how to reach me when the camera is turned off. After today, Regional Director Tyson and I would like to hear from you on a regular basis, not when issues arise, but when things are going well. What are the promising practices that you're most proud of? What's working well in Tennessee? We ask that you please share your stories of positive outcome so that we can amplify what's going well in Tennessee and what's going well in the South. Let's maximize the 20% through collaboration and by ensuring that all Tennesseans know where to go and who to call to access high-quality health care, regardless of their ability to pay. Thank you so much.
And one last thing, thank you, Ms. Perry, for joining us today. And I just want to make sure that we bring the message home and make it clear. We are here to partner. So once we leave, I got to catch a flight because I have some familiar things. My wife has an event this afternoon, but please reach out to us and let's keep the conversation going. I go to a lot of these events, make the connection only to not hear anybody, or have folks reach back out. We're sincere when we say we want to partner. So if there's anything that you all have going on, please feel free to include us in it. And, as far as Tennessee Healthcare Campaign, as you all continue to go and do work in your communities, please look at us as a partner. So thank you.
Thank you so much, Regional Director Tyson and Natalie Perry. That was really informative and appreciate your time this morning. We have a few minutes before our next